Mabeste zangu wamekufa sana. Mpaka naona Mungu si anisaidie tu.
I thank God I never died. I have tried to commit suicide.
Nikadungwa tairi, nikamwagiwa petroli, kitu likosekana ni kibiriti tu.
So I had him just breathe like he's making his last breath. I just had
chilling tales, heart-wrenching moments. But in the world of drug users, these are just part of their day-to-day lives. According to the 2014 Kenya AIDS Response Progress Report, Kenya has approximately 18,327 people who inject drugs. 18,327 Kenyans chained in the underground world of drug abuse, left to suffer the devastating effects that come with it.
Hii dawa inafanya tunakufa wengi. Unaona, mtu ameenda ameshikwa na tamaa, ameiba kitu ya mtu, amepigwa.
Mtu akiwa ameweka kasimu kake vibaya kwa mfuko, mimi nako naenda nauza hata kama ni ngiri, nakuja mimi na bibi yangu tunavuta.
And that's not all.
Kuna ule anazaa, anamlea hivi, akishindwa anauza ndio aweze kuvuta dawa. Anauza mtoto pesa kidogo 5,000, 4,000.
Many addicts have for years struggled to break free from the vicious cycle of drug abuse. And so, when the government announced plans to introduce the medically assisted therapy, many were delighted.
Si tuko lucky kwa sababu methadone tutaiona, so nasema last month, next month tutaiona, itatusaidia, unaona.
Maimuna Hassan never lived to see her dream of being unchained from the bondage of drug abuse come true. But her dream of seeing her fellow injecting drug users set free was soon to be realized, as in December 2014, Kenya's first ever MAT clinic was set up in Mathare Hospital, Nairobi.
We started a program for people who inject drugs in an effort to mitigate the risks among these people that contribute to their vulnerability to HIV infection.
This program is going to deal with injecting drug users, the males. But for the females, it's anybody who is taking heroin, either by the way of smoking, sniffing, or injecting. So the criteria is actually more relaxed for the ladies. Over time, we are going to have the program now start taking and recruiting and enrolling the drug users who are not injecting and are just smoking, but they need to quit. They want to quit.
With the launch, Kenya became the third country in sub-Saharan Africa to introduce the medically assisted therapy with methadone as its drug of choice, others being neighbors Tanzania and Mauritius. It has been promoted globally as an evidence-based intervention for the prevention of HIV and treatment of heroin addiction among people who inject drugs. Soon as it was launched, there was an influx of drug users in the drop-in centers, coming with lots of hope and expectations, hoping to get an opportunity to get that all-important dose that will give them a second chance away from drugs.
Nimekuja ndio niweze kupewa kupata usaidizi yako vile naweza wacha hii kitu.
everybody will be seen here. Okay? So please be peaceful. Okay?
One of such centers that witnessed this influx was the Support for Addictions Prevention and Treatment in Africa SAPTA Center. And among those seeking this all-important dose was Peter Washira, his wife and child.
Methadone ni kusikia nilisikia na nikaona marafiki wangu kama wawili wamemeza na vile wameendelea, hata vile mimi waona naona hiyo methadone ni mzuri.
Mimi nikiwa na 200 nikwambia bege sitaenda tuvuta dawa. Si tutavuta ishe mtoto atakula. Si ni kweli? Bege za kuwa na kidogo ananiambia kidogo. Wewe baya mtoto maziwa ya shilingi 10, hii 500 tunaenda tu. Tunavuta inaisha na nimwambia tunaenda tuache dawa. Tuone venye wale wenzetu wanakaa pia waacha dawa na wanaishi vizuri. Pia sisi tunaweza pata mabadiliko ya maisha. Au ni tunakaa maisha ya shida. Wewe tunakaa sisi ni binadamu wale wako hai. Tunakata binadamu kweli sisi. Tukae chini tukaongea tukazenga kama tukimeza dawa. Mimi nikiwacha na wao utawa juu kama wewe utakuwa mimi ndakuwa navuta na wao umewacha hauwezi wacha. Unaona juu tunakaa nyumba moja.
Nilikuwa nakuja naambiwa nigojee wiki moja, nigojee wiki mbili. Sasa kulingana na vile nimekuja leo hata niko kwa hiyo line juu nachukua watu 5 watu 7. Nimefurahi sana vile hata leo pia mimi Monday nitakuwa naweza kuenda hapo Mathare na meza hiyo methadone.
Preparation for the PWIDs, people who inject drug, is done by the CSO at the drop-in centers. And after they've been prepared, we invite the social workers from Mathare Hospital to do assessment.
The first day they will be seen first at the triage by the nurse, just for physical examination and ensuring they're not in any immediate danger that needs to be addressed first. And then screening for some infections that we also manage as a comprehensive package of MAT. Then they will go to the clinician. The clinician now is the doctor who will assess their degree of dependence and commence them on the appropriate initial dose of methadone and any other treatments that may be needed.
The aim is to retain individuals in treatment by reducing the craving for heroin while preventing withdrawal symptoms for more than 24 hours. After getting their dosage of methadone, the patients are observed in the MAT clinic for 2 to 3 hours for any adverse reactions or if they have any withdrawal symptoms. Several kilometers away, and the Coast Province was the scene for another milestone. Malindi, a town on the coastal strip, played host to the second MAT clinic in Kenya. The clinic being opened on the 26th of February 2015.
We are, number one, delighted that medically assisted therapy for drug users is on the coast, and therefore today is a historic day for us and for the Government of Kenya, Ministry of Health, because MAT is here.
When the first client got the first dose, I guess it was a relief. They look enthusiastic about the program, and they are very happy that the program is finally in Malindi to help them come out of this burden that they have lived with for a long time.
Nimeanza dawa 1996 na bibi yangu pia naye ni mwadhiriwa madawa kuleva, nilimwanzisha mimi. Alafu nilikwenda Riabu kwa miezi 4 2010, nikatoboa, nikatoka, nikaketi kama miezi 6 hivi, nikarudia tena kuvuta. Kujikimaisha mimi huwa nafanya kazi ya kupiga rangi, kwa ufupi napaka rangi na mimi ni pusha kabisa. Pedla nauza madude.
Tumejaribu kufanya home detox, tumeng'ang'ana, tukafanya, akafanikiwa, lakini baada ya muda karudi. Kwa hivyo tulikuwa tumefika mahali pa kukata tamaa sasa, ni kama ilikuwa tunaachilia, hatujui itaisha vipi. Na kama ni pesa tumetumia. Angekuwa amepewa hizo pesa hizo, angekuwa sasa amefanya biashara kubwa sana. Lakini zimepotea huko. Wakati mwingine unaangalia unasema nisipotoa hii pesa atakufa.
Like many other addicts, the addiction totally bruised Jeremiah's functionality, rendering him incapable of keeping a job.
Kazi municipal nilifanya kitu kama mwezi mmoja. Nilifanya mwezi mmoja tu. Na sikuenda tena kwa sababu ya kama sijapona siwezienda. Kaachana mwenyewe, sikufutwa, niliachana mwenyewe tu. Naambia nikiacha mwadarati wataniangalia, na huacha, lakini wananiambia ngoja kwanza tukuangalie. Sana za uketi kama miezi 6, miezi 4 hivi, nikiona kama hao wanishughulikie najipata nisharudi katika madawa.
The decision to be inducted into the MAT program did not come easy for Jeremiah, Like many others, it was influenced by more than 15 painful years of drug abuse, unforgettable ordeals, and near-death experiences.
Alipigwa na mob na watu wengi huko. Mtu wa kwanza kuja akaniita, akaniambia anapigwa sana kule, nikaogopa kwa sababu naona hata nikifika huko atakuwa amemalizika. Wa pili akaja akaniambia hata nimemwona wanamchoma, nikazimamia moto. Nikatoka mbio nikaenda, kifika hapo polisi na bahati nzuri kama amefika. Alipotoka kwenye ile gari ya polisi hata hawezi, hajijui, anakoroma tu, damu zinatoka, nasema mtu anakufa. Mimi niliomba Mungu, nikamwambia Mungu, huyo mtu asife, angalau aweze kuja yaona haya na kuweza kuambia watu kwamba hii si nzuri. Na Mungu alinisikia. Hakupelekwa polisi, alipelekwa straight hospitali.
Karibu kupoteza maisha yangu kwa sababu ya haya madawa ya kulevya. Nilipigwa mpaka nikaekwa flat, nikadungwa tairi, nikamwagiwa petroli. Kitu likosekana ni kibiriti tu, na kiribiti lilipopatikana serikali ikawa imefika karibu.
Polisi wakitushika tunawakatia na wanatuachilia. Sijaipelekwa prison, lakini polisi nishapelekwa.
We have started our engagement at Kiganjo. I think we've always been invited through the AIDS control unit in the police to be going to Kiganjo to sensitize some of the policemen who are coming out to the community and tell them that actually there's a population that needs your help. There's a population that needs you to be sensitive to their needs.
Hawa si watu wa kushikwa kupelekwa jela. Haiwasaidii. Hawa ni watu ambao ni wapatikane, wasaidiwe.
And how did you come to know about the MAT program?
Walikuja wakatufuata mtaani, wakatuambia vile iko, vile inavyokunyiwa, wakanipatia counseling. Huwa wanakuja natembelea na tupatia counseling. Sasa ukikubali poa, kama hutakubali ulazimishwe. Sasa mimi nilikubali na mpaka sasa ndo niko hapo. Nilikubali kuanza method kwa sababu nataka ni change maisha, niwe kama vile nilivyokuwa kitambo kabla sijaanza madawa.
With methadone providing the promise to recovery and a second chance to live a normal life, his will has been strengthened and his resolve unshaken.
Tutavumilia kwa haya matibabu ya methadone kwa sababu nirudi Jeremias wa kitambo. Niwe baba mzuri kwa watoto wangu, kwa family, kwa bibi, kwa hata majirani, nionekane mtu nimebadilika.
Akumbuka kwamba anataka kutoka na wale watu ambao wanataka kumsaidia wametaka kitambo. Kwa hivyo naye najisaidia, wasaidia wale wengine ili tuweze kutoka. Lakini kama na kumsupport, sisi tutamsupport.
High risk practices related to drug use contribute highly to the spread of HIV among people who inject drugs. Methadone will be an important component of any intervention package aiming to reduce HIV transmission among this population.
It improves the outcomes of all the other interventions because you're able to provide MAT in an environment where you're providing all the other services. It reduces the injecting practices and sometimes even stops completely. This has a direct impact on HIV because when you reduce injecting practices, then you're also reducing the HIV transmission. Once this client comes for MAT, for methadone per se, they are also given their ART. They are given their Septrin, they are given their ARVs at that time. So we are able even to observe them taking. So I'm sure this is going to improve adherence, and it is documented that that has happened.
The clinic in itself cannot also succeed on its own. It has to succeed as a linkage between the community where these people who inject drugs live and the people who surround them in the community, and in the clinic where we are looking at all angles of health.
The program is implemented in full compliance with the set policies and guidelines.
Our program for methadone for the people who inject drugs is guided by both the strategic direction 1, which is aimed at reducing new infections, and strategic direction 2, which focuses on improving the wellness of people living with HIV. We are also guided by strategic direction number 3, which is making sure that whatever we do is within the human rights perspective. And that's to say that under the new constitution, everyone has the right to the highest level of healthcare, irrespective of who they are.
Evidence has shown that combining MAT with other therapies such as social skills training, vocational, financial, and family assistance contributes positively to the treatment retention and has greater outcomes.
We need support to expand our economic empowerment to ensure that these young people will not stay idle and go back to drug use.
The private sector will be engaged in a conversation in order to see to what extent those who are unstabilized can either go through vocational training or job placement, or for those who are doing well, being provided with a job. But not everybody, let's face it, let's be realistic, will be able to find a job, but at least they will be able to get some training that they can go into then some self-employed jobs.
In this first phase, we aim to reach about 9,000 people who inject with drugs. We do due diligence by enrolling clients in batches, and we assess and see what is happening to those already enrolled before we enroll the next batch, and that's how we do it.
Retention of those already inducted into the program is one key factor if the target of 9,000 inductees is to be achieved. It is recommended that patients remain in the program for at least 12 months to achieve enduring lifestyle changes before considering discontinuation.
Anyone who is started on methadone is profiled enough in terms of the address where they come from and the contact persons and a treatment supporter, to the extent that if this person for some reason or the other does not observe their scheduled appointment, we are able to contact the next of kin, the treatment supporter, and we locate where this person is.
The success rate has been quite high, considering that it's the first batch of clients and it's the beginning of this clinic. With out of the current 102 patients we have currently, only 8 have defaulted so far. And by defaulting, we mean somebody who has missed consecutively 5 dosages. So, and they're no longer coming to the clinic. But out of those 8, we have traced 4 of them, and they're in the process of being reinducted again into methadone.
One of those to have been retained and exemplifies the great success of MAT is one Mark.
My name is Mark Mbio. I was born in 1981. I started taking heroin when I was 13 going on 14. I ended up going to rehab like 27, 28 times. My 28th, I believe, was I got clean. I stayed for 2 years without using, but you know, I relapsed.
Mark is one of those who have had to endure torrid times in the underground world of drug abuse. So, how was the experience, Mark?
You know, I injected so much, my veins collapsed. So, you know, I had to look for other places to inject. I started injecting my legs, moved on to my private parts when my legs became a challenge. I couldn't find vein. My private parts became a challenge, so I started injecting on my neck. At least I never missed any time on my neck or my head, because these are the veins that, you know, were the most visible and easy to find on my neck and my head.
So I had him just breathe like he's making his last breath. I just had, I came, held him, it was like he's gone. I said, now, I think now this is the day. I think now he's gone.
I was existing. I would use to get the withdrawals out, and that's basically, I couldn't get high. I used to pop over 70, 80, 90 pills, Valiums, 5 milligrams, and still use heroin. And you know, my high was, it was really nothing, you know, to write home about. I was not happy.
He used to cry, he used to pray, he wanted to stop. And then since we had tried everything, I said now, he's been prayed for, he's been even helped, given free rehabs. I said, now God, now you do your rest, you do the best now we can do with this one, because now there's nothing we can do.
A lot of clients who we deal with will tell you they've tried other forms of interventions to stop the drug use habit, and for many years. But what we find with heroin, it's a very addictive drug, and what happens when you give somebody methadone is that it stops that craving. So that makes methadone a more, even more desirable and more effective treatment for these clients.
So one time I was reading the paper and I saw NASCOP talking about a methadone which was going to come. Then they said it's going to be administered through Mathare, and people have been going to MDM, and he was a client there, I used to go there, I said, here we are in business. But on the other side, I said, if something better than heroin, let them try and we will see.
The future of MAT in Kenya looks bright, but to meet the high demand for drug dependence treatment in Kenya and for the program to succeed, there needs to be unwavering government commitment and proper funding for the program.
The government is committed to making sure that this program that we've started is sustainable beyond the time period that the partners, in this case donors, have committed to support. And that's why whatever that we do is pitched within the existing government documents, within our strategic framework, and alongside what I mentioned earlier, we also focusing on resource mobilization for the entire HIV program, not just methadone. In future, we are going to see an increase in domestic financing for the HIV program, including methadone.
It's one that needs both the Ministry of Health, the donor community, the partners that are supporting this effort, the community organizations working together as one unit to see to it that the barriers to access to care are dismantled, the coverage of this population reaches its optimum, therefore the impact for the services and for reducing the harms are actually reached.
We need the political goodwill, one for the commitment of resources to have these programs be sustained. We also need the law enforcement. The law enforcement remain a very critical partner. Engaging with the law enforcement, engaging with the judiciary. Is it a way of having special drug courts like many other countries are doing? Is it about changing bylaws, you know, or that can accommodate our programs? So once we have all these partnerships, then we'll have a whole spectrum of services uninterrupted. But the moment you don't work on these strategic partnerships, then you'll always get this backlash. 92% of all the clients who've started methadone have actually reported that they stopped their criminal activity because then they don't need that extra money to sustain their lives. And that's why we have seen crime rates really reducing in a certain area. And because we engage with the communities every day, we have seen some of them saying that we actually don't get people stealing, waiting for women or children on the way. We've seen them say that actually the environment are now safer when now you go to the community level.
This is the first day when he has started his methadone here in Mathare Hospital. Can you see the difference right now?
If I don't get my methadone, I don't get mark. If I don't get my methadone, I don't get a job. If I miss my methadone, I'll miss mark. I'll just be lost. So methadone right now is my life.
Methadone, it's real. With the changes we have seen from December, from the time they started using methadone up to now, there's a lot of change. It's like a plant which is germinating, you know, and we are looking forward to have a fruit.
Nasikia niko sawa, hata mtoto wangu mwenyewe pia ako sawa. Nasikia nimebaki fresh kawaida. Kwenye muku hata yotaki yote sisikia dawa ama nini. Itabidi sana kwenda kuja kila siku na kunywa methadone. Juu ananipeleka vizuri na mwili yangu.
Methadone offers a renewed hope to those rendered hopeless by the drug problem in Kenya.
And he has even talked back of saying if he gets a job, he's going back to university to sponsor himself to go and continue because he had started.
Nitakata ka business kangu. Hata naenda Gikomba na nunue tu viatu, tunguo na nauzia tao huko. Napata 500 ama 600 na sijaibia mtu.
There is hope for those who have been injecting. There is hope for them to stabilize their work, to look after their families, to get a job and have a better life.
Wanatumiwa na watu ambao wana hizo dawa, watu ambao wanapata pesa nyingi kwa sababu ya kuuzia hizo dawa. Wanatumiwa hao kuwauzia watu dawa, wana nini? Watu wanafaidika, wanatajirika, hao wanakufa tu. Hivyo mimi ningewashauri kwamba wangefuata hizo njia za nini za kutafuta kutoka.
Kama umechoka na hiyo maisha na kwa kweli kuna venye unaweza taka kusaidika. You really want to get out of drugs. Just come cool, just if you come to the MAT clinic and you'll get help.
Oh, there is hope. We can smile again. We can be proud parents. Our children are going to be, our sons and daughters are going to be what we expected them to be. Thank you to Methadone.
With its introduction, it is expected that the country will finally see a lasting effect in heroin addiction management, subsequently witnessing unprecedented decline in new HIV infections among the people who inject drugs.